and that will be in two parts, this session. So Anastasia is going to talk about raising awareness and profile. Then we do the coffee break, because we started a little late, and then Dale will talk about working with the media. So now the floor is yours.
Thank you, Mark. We're running a little bit late, but I will try to keep it short. So when we were discussing with Mark about the possible topics of this Alzheimer University, we thought that raising awareness and profile would make perfect sense for you, because I know that most of the associations here are small and you are struggling with awareness raising and you are struggling with budget too. So I will take you briefly through my presentation today. We will start by identifying what do we mean by raising profile and awareness. I will help you identify your aims. I will take you through some basic steps on how to develop an awareness strategy. And of course, we will discuss some of the issues and the challenges that happen when we are trying to raise awareness for dementia. Of course, I would like to share your ideas throughout the presentations and share your feedback. That will be really helpful for everyone. So I will start by discussing with you what do we mean by raising profile and awareness. I'm pretty sure that all of you are trying to do a really good job when you are trying to help people with dementia and their caregivers. But what if no one knows about it? No one knows about what you're doing, or a few people know. How will you continue to do the work you are doing? So if I was going to ask you what we mean by raising awareness, what would you tell me? Just try to put it in one sentence. Can I have some ideas from you? Getting known. Guys, right. So for our movement, raising awareness means actually educating caregivers, educating healthcare professionals, reaching out to people with dementia, making our own associations known to the world. And I'm sure you're all trying to do these things. When I was putting together the presentation, I wanted to come up with an example of raising awareness, a successful example. So I was thinking about pink. And when I say pink, what do you think? What comes in mind? Breast cancer. So exactly, this is what it means to have a successful awareness raising. We have the pink ribbon, and the breast cancer movement has been really successful in using that and making themselves known to the whole world. So I'm sure you will agree with me that having a mission on its own is not enough. It's like trying to reach the top of a mountain, but in order to do that, you need to let the public know what you are doing and how you are helping the people with dementia and their caregivers. So the first important thing is to identify your aims. You need to know exactly what you are aiming to achieve. What are your aims? If somebody would ask me, what does ADI do? I would be able to say it in a couple of sentences. And I was wondering if you know who you are and what you are doing to achieve your aims. So I wanted to have a little practical exercise. I want you to think about who is your association and what are you doing, what is your aim. And when you're doing that, please consider who is your audience and what is the message you want to convey. And please take a couple of minutes and write in 2-3 sentences who you are, and then we can share it with the group. So I think we have one brave person, Edna from BVI, that is already done, and she might want to share with
Yeah,
us.
Yes. In terms of our vision, we do envision a BVI community that is dementia-friendly. That is our clear vision statement. In terms of a goal, our goal is to provide public or community awareness, education, prevention, risk reduction, support, using a multimedia approach.
Okay, that's clear to me. How do you feel about Edna's statement about who they are? Was it a clear one?
Like TV, radio. Oh, got you. I'm sorry. Okay.
But Julie Kay, do you want to share your feedback about your association?
When someone questioned multimedia approach, it means utilizing presentation, public presentation, TV, radio, online newspaper, print newspaper, post, Facebook, Instagram, Twitter, the whole gamut of communications.
Great. So
strategy.
Edna identified not only what they want to do, but also how they're going to do it. So this is really good and clear. Julie Kay, you want to share your statement with us?
Actually, it's not much different, but, with our organization, the support group is basically to educate the general public, as well as caregivers, family, and friends. That's one of our mission statements as well. And like Adna, sometimes we do put on the radio when our meetings are going to be and where they will be held, things like that. But people I find now is not much into radio because of all the Facebook and
Social media,
yeah. It's crazy.
Anyone else from the other tables that would like to share their statement with us?
I think they have a clear idea here.
Yes. Well, in Suriname, our association, we have 3 pillars that we are going to attack, and that's foremost research, so to gather the evidence that's needed, the awareness, and the awareness is to the public to come to a senior-friendly hospital, senior-friendly communities. And one of the most important is the training, and the training is specifically to the carers because of the financial problems in our country. Putting elderly in homes or paying for help at home is often not possible. So we think that the most benefit we'll find is indeed training the carers to take care of their elderly.
Thank you. Anyone else?
Yeah, Barbados. Oh, here. Oh, Mavis.
Yes. I think that Christine forgot something. One of the first aims we have that is that we want that dementia is recognized as a disease. Huh? Yeah,
Yeah, you could say that's part of awareness.
Yeah.
But it's true, I think, why are we called Alzheimer's Disease International and not Dementia International, is because in the very beginning, there was a discussion about dementia is seen as something of normal aging, normal part of aging, and we must make clear that it's a disease. It creates sometimes confusion, and they say, so you're Alzheimer's disease only, what about the other dementias? Well, our name is Alzheimer's and Related Disorders Societies, blah, blah, blah. It's a very long name, the official registered name. But this is an issue true in many countries still, being recognized as a disease and not as normal part of aging. I see hands on this table, that table. Was a good question.
Okay. I think
Obviously.
our overall thing is a combination of everything that has been said by the other 2 groups. So we just have it short and sweet, I hope, is to educate and promote awareness of dementia. That is a broad, sweeping statement that with all the encompasses that you guys have spoken about. We
Good,
also
thank
do
you. That
our,
was-
before promotion things, we manage to do TV programs, we do interviews on the radio, and we go around the country speaking to other social groups, churches, other NGOs and stuff like that to have that awareness and to focus on that education and awareness.
There's actually a program that is being researched now for Barbados where meaning Pamelia, will be on the radio talking to the public of Barbados about dementia, question answers.
Thank you, Pamelia. And I think there was...
But we do workshops aimed at community-based organizations as well as communities, and we do both at the micro, meso, and macro level. So we have also met with our ministers, Zaid and I, our Minister of Health. So we have done that kind of sensitization about the signs and symptoms because a lot of our population are not aware of the signs,
Yes.
but our persons with dementias are displaying those things, and their carers are not aware what it is. So we do that.
Thank you. Yes, thank you. We could keep going on discussing what we are and what we do, but what I really wanted to make you start thinking is, what will you do if you go into an elevator and all of a sudden you meet the Minister of Health? You will have to explain who you are and what you do in less than a minute. So I want you to really think of like a 2-3 sentences paragraph that really says who we are and what we do. This is an exercise for home. So what are the goals of public awareness? Why are we doing all this awareness raising? Of course, we want to educate the community, as you said, to reduce the stigma and make people understand that dementia is not a normal part of aging. We also want to inform the community about our own associations, our own organizations, what we do, what services we offer. We want to have more people involved and hopefully gain some more volunteers for our cause. And of course, we want to lobby and advocate for change. And what are the outcomes of public awareness? If we do it properly and effectively, what we will achieve? We will be able to serve more people with dementia and their families in a better way. We will recruit volunteers to support our cause. We will manage to change the perceptions and the stigma in the general public. And of course, that will enable us to raise more funds. So now I will take you through the basic steps of developing an effective awareness strategy. We will have to always start by identifying our target audience. Who do we want to speak to and what about? So then we need to create and frame a really strong message, and that will help us also develop a very distinctive brand. While doing so, we need to have facts, we need to have figures, we need to have human stories. And all these will end up in a call for action, something specific that we will ask our audience to do. So starting with identifying target audiences, there is a list of the possible target audiences that dementia associations can approach. Obviously are the people with dementia, the carers, families, friends, the general public, media, the government, other social care organizations, healthcare professionals, and any other person or group that you think might be helpful in your efforts. Then we want to create a strong message. This is an example I took from the Alzheimer Society in the UK, and it's about their Dementia Friends, which is one of their flagship programs. So this is their messaging. As you see, not many words. There is a person, there is a human element, it's Gina. She is asking people to do something, to attend a face-to-face information. She has a clear message, I'm a dementia friend, and there is also some branding. You can see the little flower, the forget-me-not. So this is what creates a strong message, something simple, something that carries emotion, something that is asking people to do something specific. Then we need to develop a distinctive brand. And what is a brand? A brand is what people think of you when they see your logo or your name, what that evokes to them, what feelings, what associations. Of course, you need to have an easily recognizable logo. You need to convey the customer experience, as I said. It needs to be a symbol of your organization and needs to be distinctive. I found this very interesting definition of what is a brand by a branding agency in Australia. I'm not going to really stay here. You can see it in your handouts. But again, it talks about the importance of having a strong brand and conveying who you are to your audiences. I also said that it is really important to use facts and figures. For example, what is the number of people with dementia in your country? What is the likely increase? What is your association planning to do in order to help? Here in the Caribbean, I know it's very difficult to get numbers, as you said, for the individual countries, but you could mention something like for the whole region, like this line I have here. Of course, when you don't have specific country-specific data, you can also rely to our global data, and then you can showcase how dementia is the global epidemic of the 21st century. I'm sure you have seen these graphs before about the global prevalence of dementia, how the numbers will almost double every 20 years. This is a map that shows the estimations around the regions of the world. The incidence of dementia, 1 person every 3 seconds. This is a very powerful message. And by showing you this, I just wanted to let you know that when you are talking with data, with figures, with numbers, it's really important that you use infographics, you use diagrams, something that makes it visual and it's easy for the audience to understand. A very important element is using human stories. We are emotional people, we have compassion, we have feelings, and you need to use these feelings in order to get your message across. Again, here I have an example from the Alzheimer Society. It's a video, it's an advertisement they made last year about a memory walk. And I just wanted to show you that briefly and how they used emotions. So I hope it will work. Just give me a second.
Sign up for an Alzheimer's Society Memory Walk near you today. Go to memorywalk.org.uk.
So that was the short video I wanted to play. Going back now, I'm sure you will argue that the Alzheimer's Society has enough money to make these kind of nice videos. And I can tell you that you can do the same without a budget. There are other ways to get around that. For example, you can use people with dementia or their caregivers, get their stories and take them to the media. I'm sure Dale will agree with that. And it's really powerful to have their messages. You can have people with dementia or their caregivers sharing their stories in conferences like that. I remember last year in Barbados how powerful it was to have that lady with the early onset dementia. And it's powerful for the general public, but it's also powerful for us. And I have the feeling that it reminds us why we're doing the work we're doing. You can use social media, so please try to be creative and try to use the human stories. It's really, really powerful. And of course, as I mentioned before, the awareness campaigns always ends with a call for action. In marketing, a call for action is a very clear statement where we ask people to do something. So you can ask people to do something on social media, as UNICEF is doing that. Tweet their pictures, send their stories. You can ask them to make a donation. You can ask them to register as a dementia friend. You can ask them to be volunteers. You can ask them to give them your email, whatever you think is relevant for the purposes of the campaign you are doing. Of course, there are many types of awareness campaigns, and that always depends on what we are trying to achieve. You can see here we have leaflets, we have press articles, poster campaigns, conferences, events, social media campaigns. Of course, for us, the World Alzheimer's Day and Month awareness campaign is very relevant. You always need to take into consideration who you want to reach and what you want to achieve, and then try to choose which is the best way to do that. As I mentioned before, World Alzheimer's Month and World Alzheimer's Day is a really good tool for you as an awareness campaign, and you can take advantage of that. We're celebrating every September. The theme this year, again, is Remember Me. We have many countries participating in it, and it is a really good opportunity for you to have awareness activities such as memory walks, providing information, having appearances on the media, doing fundraising events, and whatever you think is relevant for your country. You can get involved by going to our website. You can take there the information we have, the materials. You don't have to be a full member. This is open to everyone. You can spread the word on your social media, on Twitter, on Facebook. You can follow us, and you can capitalize on these materials we are giving you. So I was talking about raising awareness, but then it occurred to me that it's not an easy task, especially when we're talking about dementia. Dementia is not a sexy issue nowhere in the world. And I'm sure we all know that there are certain things that hinder us when we're trying to raise awareness. And I think it's a good thing to realize that no matter where you are in the world, you are facing some of the same issues, some of the same problems, and we can work together and find ways to tackle these issues. So I wanted to ask you, what are the issues what are the challenges you face when you're trying to raise awareness in your countries? And maybe we can then discuss how we can tackle this.
In my country, the Cayman Islands, one of our challenges that we have is that, like everywhere else, people think that it's an old person disease, and they're, you know, an old person, why do you deal with it? So they support the dogs, the cats, the Humane Society, the Cancer Society, and those things where young people are involved in cancers. If you have a childhood cancer event, you'll have the whole of Cayman there. If you have an Alzheimer's event, you may have 50 people there. And that is our biggest challenge on our island.
Okay, so there is lack of awareness, and also the focus is on younger people.
Well, we have a lot of awareness campaigns. The awareness is there. We talk to them, we do it in Facebook and on social media. But no, we're not, a small group are listening. Unless it touches your family, no one's concerned.
Mm-hmm. Other issues, Edna?
To continue on the comment, even if it touches your family, many of the family members are still in denial and do not want to, as one would say, come out the closet and be known as having someone with Alzheimer's or with any other form of dementia. So that whole issue of denial makes it difficult to really start family support or any support group within our territory.
Lots of people don't want to come out because the fear of stigma, because they're still related to a mental disease. So we have to insist that it's a brain disease.
One of the things I've noticed as well is that people still think of when they say Alzheimer's that it's just memory loss. And they don't understand the ramifications and the further, what will happen as things progress. So when they hear memory loss, they just think, well, that's older people, that's what happens to people anyway. So it's, again, trying to get that message across.
In the materials for this year's World Alzheimer's Month, there is a nice overview of the 10 warning signs. So, and that's with cartoons. So not just the text. And these are all the things that people face. There's all kind of cognitive issues like not able to finding doors or entrances, troubles in dressing yourself and things like that. Yeah.
Thank you. I'm a member of the Mental Health Association. In fact, I'm representing the dementia group on the Mental Health Association. And the point that Norma just made, I find it difficult to push back to that because you're distinguishing between a mental health, dementia being a mental health issue. And in fact, I can't argue against that. It's a brain disease, brain issue, but it's also a mental health issue. So do you distinguish between those when you're trying to make the case for dementia itself?
Yeah, that's quite a big discussion. So officially, dementia is a neurological disorder. In the WHO, there is a section that's covering mental health, neurological disorders, and substance abuse. But in many countries, it's the mental health department taking care of. I'm not sure if we have time because the coffee is waiting for us. I have one last because she's waiting for a long time.
I think the difference is the economic level. Middle-class families can take care of their members ably, while people of lower income, they are the ones who really are not getting the help.
Yes, thank you. So I hope I gave you some. Sorry, yeah, you would. Okay, I hope I gave you some food for thought about raising awareness. I want you to keep these challenges in your mind when you are developing your awareness campaign, and I wish you good luck in your efforts. Thank you.
I think there's some urgent comments still. You too. Yeah.
No, not
just for me. Okay, where can you find the cartoons? So World Alzheimer's Month website is worldalzmonth.org. It's on the slides. Everything on the website can be downloaded. Everything is for free and everybody can use that. So last year we had 2 companies that joined the campaign as well, internally, big companies for their staff. And so we make it available for everyone. It's worldalzmonth.org. And there are sections where you can download all the materials and print them out yourself. I think you had an urgent thing or not anymore?
From Barbados, I just want to say that there's really great awareness, and the president and many of us have traveled with her to schools and churches, and persons are really getting aware. Every day in the office, as soon as she gets in, she gets some calls, and there are persons who are really aware and who comes in. We just had a fun walk with the Central Bank, and we also had awareness at a mall, Sky Mall. So people are getting on.
Okay, I think it's time for the coffee break. We're already over 11. And then after the break, Dale will do the second part of this session about working with the media. Maybe one last comment is that at our conference in Kyoto, you were not there. There were quite a lot of younger people from Asia who are a caregiver for their father or mother or grandfather. And they said, we want to help bring this awareness campaign forward. And we asked them, can you make little videos of younger people telling about how the disease affects their lives? Because that could be a way that we take it away from, this is only an old person's issue. It's not, it's affecting all generations. Okay, coffee break. I'll see you back at 11:30.